am Joan Cartan Hansen. Thank you for joining us. This is Dialogue Web Extra. We're talking with state epidemiologist Dr. Christine Hahn about the swine flu, the H1N1 virus. And in this particular Web Extra, I want to focus on preparedness, not for necessarily for people, but for business and government, because quite often in a pandemic, they have not gotten organized. And let's talk a little bit about what should a company do to be able to prepare for a pandemic.
Right. We have been working with businesses and state agencies throughout Idaho for a couple of years, trying to get them to start thinking about this, because it's something that's hard to think about when it doesn't seem like you're going to need it. I'm hopeful that people now realize they do need this. The types of things we ask employers to think about are, first of all, some of the stuff's pretty straightforward. What do you do if your key employee is out sick? There should never be only one person that knows, where the key is to the safe. Yeah. And so we ask people to think about always having backup and redundancy. A lot of people are used to doing that for routine things. People get out sick and so forth. But even trying to multiply that to your head of what if several of your employees are out. But it even gets more complex than that, and including things like school closures, which we've just gone through in other states around the country. What if you have lots of your employees have kids? They may suddenly all have to go home just to watch their kids. So do you want to think about an emergency plan of having a daycare or childcare option for your employees? So there's lots of things like that to think about. Also, if you ask employees to go home because you're concerned about spread, are you going to have a way for them to work from home? So thinking about work from home options. Lots of things for businesses to think about.
What are some of the more global things that they should think about in terms of how to establish policies within the workplace?
Right, and that's something.
And the CDC has a checklist that you can find on the CDC website. We've got that link on the Dialogue page. You can go to idahoptv.org. Well, actually, you're already there if you're watching this on the web, or you can go through our Facebook. But they have a checklist for businesses and government.
Right. There's been a lot of planning at the government level for this type of event. And cdc.gov, or more directly, pandemicflu.gov, there are lots of great resources for businesses. And I love the checklist, because who doesn't like a nice little checklist that you can kind of work your way through? It's got lots of great information and ideas in there. And like you mentioned, some of the policy issues are kind of tricky, such as sick leave. Are you going to ask your employees to take a vacation if you ask them to go home? Well, there may be some disagreement about that. So really thinking through policies and how you're going to handle those. Also things like you might want to have alternate work schedules put in place so that some people might come to work in the evening, for example, to keep people more
so you're not getting large numbers of people together in one place.
Exactly. So there's all sorts of things to think about. And one thing I like about the checklists and those resources is they kind of expand your brain a little bit. The other thing with businesses is during outbreaks of disease, some businesses are going to see an increase in demand and some are going to see a decrease. So even planning for things like that, what's going to happen to your business? If people are afraid to go out and you run a movie theater, you might anticipate a drop in your business and try to think about planning for that. On the reverse side, if you manufacture hand sanitizers, I understand they're hard to get these days. So things like that are important to think about just from a business perspective too.
And while we've got you here, let's run through the symptoms that are of the H1N1 virus, the swine flu. Let's run through those real quickly.
Right. The most common symptoms that are being reported are fever and cough. Right. So kind of classic flu symptoms, but headache, muscle aches. I always remind people say, how can I tell if it's the flu or it's a cold? You don't really get muscle aches with a head cold. It's your head that feels bad. The rest of you usually feels okay. But flu will really give you those muscle aches and kind of just make you feel like you've been run over by a truck. They also sometimes, though, with this swine flu, they've seen some persons having vomiting and diarrhea added in there as well. So there are several symptoms like that need to be watched out for.
And when should you go to the doctor?
For right now, we're recommending people go to the doctor when they feel sick enough that they would normally go to the doctor. If you have a mild cough, a little headache, we are not urging right now that you rush on in for assistance. On the other hand, if you have a heart condition or a lung condition and your health is frail in some other ways, you might want to go a little sooner rather than later, because there are medications that can be effective, but you need to take them pretty early in the first few days of illness. If you wait too long, the doctor might be able to say, yep, you got the flu, but there's nothing I can really do for you at this point. We got to hope that you heal yourself.
So if you're really feeling terrible that first day, call in for an appointment.
Call in, especially if you've got underlying health problems and you got bronchitis, or you have asthma, or you have some other health problem that you don't tend to do well with coughs and colds.
Is there a chance, since it seems to be kind of starting to kind of calm down now that we'll see this rise again in the fall?
Yeah, that's our big concern right now. It certainly seems that what we're seeing right now in the U.S. is not dire at the moment. We are seeing people get sick, certainly a few deaths, but nothing to the point that we feel the pandemic has now hit. But in the fall, that's our normal flu season in the United States, and it is very possible this virus could come back then and be more severe at that time.
So this fall you may be getting 2 shots. If you get your regular seasonal flu, you may get a second swine flu.
Yeah, and that's not been determined yet, decided. Okay. For sure there'll be the regular flu shot that we're always promoting and encouraging people to get, but it's possible that we'll also have a swine flu shot. It's probably that decision won't be made until mid-late summer, whether to try to have something like that available.
And maybe this is the year you should get that pneumonia shot.
Yeah, the pneumonia shot, I always recommend that for folks who are either elderly or have heart or lung conditions or smokers, those kind of things. But especially now with this concern about the flu, the pneumonia shot is really important because a lot of people that end up getting very severe flu, what happens is that flu settles into their lungs and then they develop a bacterial pneumonia. And these pneumonia shot can help prevent that.
Now, is the pneumonia shot one you do once and you're okay for the rest of your life, or is it something that's to be repeated every 5 years or so?
It's the recommendation is at least once, and if you're younger when you get that, you might need to repeat it in about 10 years. But really, it's good for a long time, not like the flu shot where you're taking it every year.
All right. Yeah. And if you have questions, you can go look for the links here on the Dialogue website, or you can go to the state's website at panfluidaho.org.
Yeah, we have a panflu.org site. We also have our regular health and welfare site. You can get links from there. And we've just changed we had a swineflu.idaho.gov, which I think that link still works, but we are in the process of changing that to flu.idaho.gov website. I think either of those will work right now.
And the CDC.
And the CDC really has been a great source of information, and that's just cdc.gov.
And you'll find all those links here on the Dialogue website. So take a look for it at idahoptv.org. And thanks for joining us for this Dialogue Web Extra.